Hello and welcome everyone to the PharmaSense webinar series. My name is Mohammed Usman and I will be your chair today. Due to high demand, we have decided that today's topic will be pharmacy application and interviews. We have received multiple questions on our social media pages and we plan to hopefully address them throughout the webinar. Our speakers today include the PharmaSense team, Sarwar Shah, Nabeel Hajazi, Aiysha Raoof and Ayat Ghafori. I am also excited to announce our guest speaker, Arsalaan, who has experience in community pharmacy and currently practices as a clinical pharmacist in HM prisons. Today's webinar will be split into two parts. Part 1, consisting of the application process, which will include information on where to locate vacancies and our advice on completing applications. Part 2 will include the interview process. In this section, we will look to deliver both general and highly specific interview advice in relation to the 4 sectors that we will be addressing today. Part 1, the application process. As I previously mentioned, the PharmaSense team are always receiving questions, and one of the most common topics includes advice on job hunting. I hope that in this segment of the video, we can help advise on where to first look for roles and how to decide if a role is fit for you. Prior to searching, know what you are looking for, if you're willing to relocate, and what hours you would be willing to work. This will help narrow your search so you don't get overwhelmed with pages and pages of jobs, which is inefficient and will only lead to frustration. A huge aspect of pharmacy that we encourage is networking, which is key not only for searching for vacancies but for future development. Ask your colleagues and fellow pharmacy professionals for advice and if they know of anyone looking to recruit in the sector you wish to pursue. For roles within community pharmacy, vacancies will often be advertised on company websites and recruitment sites such as Indeed. Recruiters have also been approaching individuals through websites such as LinkedIn, so we always encourage to take advantage of platforms that are available online. Now, for jobs in primary and secondary care, most roles will be advertised through NHS Jobs, so it is imperative to go and visit this site and be familiar how to use it. A great feature of this site is that you can refine your search to location, the role, the band, and whether you want part or full-time hours. So overall, this is a very useful tool to find exactly what you're looking for. You can also be added to the NHS Jobs mailing list. This will give you regular updates with new jobs that fit your criteria. Private hospitals may be advertised on sites such as Indeed or Google Job Searches. So just to summarize about searching for vacancies, roles are out there. For a role you really want, you may have to be willing to compromise and relocate. Remember, getting your foot in the door is the hardest part. After, further opportunities will present themselves. I'm now going to pass over to Sarwar and hopefully he'll talk to you about reviewing job advertisements.
Thank you, Usman, for that. I think you raise a lot of important points, especially about the networking aspects, which we do promote quite a lot. So what I will be discussing in this slide is about the reviewing of job advertisements. So upon coming across job advertisements, it is important to thoroughly read the advertisement, as there is key information that should be extracted to see if the role is for you and if it is what you are expecting. Find out what the trust, the company or the primary care network you are applying to is looking for and what they are expecting from you. Is the role face-to-face working? Is it ward working, or is it dispensary based? Also, find out if there's any specific requirements in order to apply for the position, i.e. some roles may require you to be able to drive, being able to commit to postgraduate studies. Some may require you to have extra relevant postgraduate qualifications. It's important to know if you do not meet the employee's essential requirements for the role, there is no point applying, as you do not fit the criteria for the position. Furthermore, this will highlight your name to the employer as someone who applied for a role they are not suitable for, and this may affect future applications. With many job advertisements, specifically those within NHS Jobs, there will be added attachments. Ensure to read these attachments, as they will hold vital information that will help you for your application. So the job specification is commonly within the advertisements as an attachment. This document is imperative to read, as it will have key further information about the role, the requirements, and what the employer believes to be essential for you to have, and what qualities/qualifications is also desirable for the role. Within role requirements, it's important to note the location details of the role as well. Those that are applying for relief positions know what locality the role is for, what you will be covering, and what range they can expect you to cover, and if this is suitable for you. Some roles may require working in multiple care homes, multiple GP practices, etc. So if transport is an issue for you, it is something that must be considered. Another important detail to note within job advertisement is working hours. Many of you listening in will have family commitments or extracurricular activities / other commitments. So find out what the working hours are and what you will be expected to carry out. Within each sector, this may vary. So have a look into how many weekends you are expected to work, how many long days, how many evening shifts, how many extended hours. Within secondary care, find out on-call commitments. How often are they? You expect to stay overnight when you're on call. These are all things that you need to find out. So all this information is important to obtain, as you should have an understanding of what the role encompasses and the work-life balance of the role prior to making the decision to apply or not. Also, with the roles of pharmacists evolving, it is imperative to know what further training is on offer from the company, the trust, or the primary care network. Have a look if there is further training included with the role. What training is on offer? Is it a diploma position or not? With many of you listening in becoming provisionally registered pharmacists soon, it's important to know what support you will have. Although you will get 2 months notice as a minimum from the GPHC with regards to the examination date, it's important to know what details of what support the employer will put in front of you. This means in terms of working flexibility prior to the examination. Although this may not be stated in the job description, more information about this can be found by contacting the named person. On the topic of contacting the named person in the advert, I always say it's a good idea to contact the named person on the job description for further information, to ask any questions about the role that's not listed in the job description or specification. This also acts as a little introduction to the employer and shows that you are eager to learn more about the role and are passionate. So, in summary, an appropriate review of the job advert is not only essential to find out if the role is for you, but a perfect opportunity to help cater your application to exactly what the employer is looking for, and to introduce yourself to the employer and help you secure an interview as well. So I'll pass it back over to Usman now.
Thank you, Sarwar. A lot of key information there. I'm now going to pass over to Nabeel, who's hopefully going to talk through completing the application process.
Thank you, Usman. So I'll just talk you through completing the application process, where I'll give you some general tips and tricks that you should be aware of. So regardless of what format the application is in, whether it's an application style such as those on NHS Jobs, or applying for jobs using a CV or any other websites, I'll talk you through some of the key points to consider when applying for jobs. The first thing is to cater your application so it's specific to whatever organisation you're applying to, whether it's a hospital trust, a primary care network, or a community pharmacy. It's imperative that you understand the organisation's values, ethos, as these are the founding principles that the organisation is built on, so it's worth understanding their values and seeing how they resonate with yourself as an individual. When applying for jobs, it's important to take these values into account, as you'll know how you'll fit in within the organisation itself, whether it's something suitable for yourself. We understand that it may be difficult to cater each one of your applications to each organisation that you're applying to, due to the number of applications that you may be completing at the same time. Good news, the bulk of the application relating to your experiences can remain the same. However, we do suggest that you review and incorporate organisational values in your applications to avoid them sounding generic, as this will come across to the person that's reviewing your application. Before I move on to CVs, I'm just going to touch up on NHS job application process, as a lot of jobs, depending on which sector that you're applying to, can be found on there also. I would suggest take your time in completing the applications, as it can be lengthy, and ensure all your personal details are up to date. We have heard of instances where candidates haven't heard back for interviews or jobs because of incorrect or out of date contact details. So it's imperative that you make sure all your details are up to date on there. With regards to CVs, a general rule of thumb is that it shouldn't be more than 2 sides of A4, and it should include your contact details, your up-to-date employment history, your education history, any voluntary work experiences, and any additional qualifications, and any details of contactable referees. If you're applying for a job using a CV, I would suggest accompanying this with a cover letter or a supporting statement addressed to the organisation, where you can include the job role that you're applying to and any further information on why you're applying and why you are the ideal candidate for the job in order to support your CV. It's important to mention any additional qualifications that you have undertaken and how they may relate to the role that you're applying to. Examples include leadership and management courses, which will help showcase development of any existing skills and help you stand out from other applicants. It's also worth mentioning any extracurricular activities you have been part of, whether these are societies from university, any hobbies or interests, as it'll show that you have a life outside of work, and it'll also help showcase any transferable skills and the ability to de-stress following a busy day at work. I'll quickly touch upon references. So depending on your level of experience in the world of work, if it's your first job, for those that have just completed their pre-registration year, then an academic tutor alongside your pre-reg tutor or manager may be sufficient. For others who have been in employment, an up-to-date employment reference would be sufficient also. So what to do is speak to your referee beforehand and let them know to expect a request to provide a reference, as there have also been instances where referees haven't been aware or out-of-date contact details have been provided, and this will only delay your application and even result in it being unsuccessful as well. Lastly, I'd like to touch upon grammar and spelling, and I can't emphasize on it enough. The Pharmacist team are always getting requests to review applications, and the one thing we always highlight is this. Spelling and grammar are so important, as it will be picked up when the application has been reviewed. It also gives you a bad image to whoever is reviewing the application. So make sure you get a friend or a colleague to cast their eyes over it before submitting it. And the same applies for structure and ensuring that you're within the word limit that's specified. I hope I've managed to shed some light on completing applications. I'll just pass you back over to Usman to introduce the next section.
Thank you, Nabeel. You definitely have a lot of essential information there. That concludes part 1 of the webinar. We hope that the viewers found this section useful and it helps for the application process within pharmacy. Now we're going to move on to the second part of the webinar, the interview process, and I'm going to pass over to Ayat to speak about hospital pharmacy first.
Thank you, Usman. So it's important to note that every trust will differ in their approach to interviewing. However, there are some common aspects to take into account. So two main things that I wanted to say before we go into the main bulk of the information is to call beforehand and ask about the nature of the interview and what to expect. Now, it's a perfectly acceptable question to ask, and it will only help to ease your nerves as well and to manage your expectations so that you know how to prepare and what to say while you're at the interview as well. The other thing I would say is to make sure you research what a hospital pharmacist does. Now, a lot of individuals won't have had hospital pharmacy exposure prior to applying to a hospital pharmacy job. This shouldn't deter you from applying. However, it is very important to know what a hospital pharmacist does, just so that you're prepared for your interview. And also, it's just good for your own understanding as well. So I'll refer you to the RPS Hospital Pharmacy webpage. This is readily available, so if you just type into the Google search bar or even into RPS's search bar, if you just type in hospital pharmacy, it will give you a bit of a breakdown in terms of what a hospital pharmacist does, and it gives you a bit of a background as well. Now, to help deliver this information better, I'll be splitting it into 3 sections. So the first one will be tests, and then interventions, and then we'll just have another category of other, which I will expand in later on. Now, when it comes to the test, there are 2 different tests that you may be given in a hospital interview, one of which is a clinical screening of a drug chart, and the other is a calculations test. Now, when it comes to clinical screening of a drug chart, this is typically a drug chart that you will commonly see in a hospital setting, so it's nothing out of the ordinary. You will have some resources available to you. Typically, you will get the B&F. Sometimes you might get some supplementary information on the side, so that might be blood results or just a patient case on the side as well. What I would say is it's very important to develop your own screening technique. Now, if you've never seen a drug chart before, I was in this position as well. Don't be too disheartened or don't be deterred from the situation. What I would say is that it's good to familiarise yourself with a mock drug chart. Now, King's College London have a readily available teaching drug chart online. If you just Google mock drug chart, the link will come up, and we'll send the link out as well. This will introduce you to the basic layout of a drug chart. So if you've never seen one, you don't know what one looks like, I would advise that you start here, and it will give you a bit of a good background, and it will introduce you on what to expect. Of course, every single trust will have different drug charts. Some trusts might have electronic prescribing, but typically their layout is fairly similar. So it's good to familiarise yourself. Now, the important thing is to have a look at patient demographics. So the drug chart or the patient case that you'll be reviewing, you need to make sure that you check, is the patient pregnant, breastfeeding, are they elderly, is it a child, is it AKI or CKD, anything like that, basically. In terms of patients' allergies as well, so you need to make sure that the allergies are noted. And if they're not noted, you need to ensure that this has been checked. So a lot of times the allergy box might be not filled in. A lot of times when I'm on the ward, it's just not filled in, and people automatically assume that there is the patient has no allergies, but it's something that you need to flag up and something that you need to check as well. Now, in terms of common interactions, this commonly comes up on drug chart cases as well. So off the top of my head, I would say maybe the statins and your macrolides, your DOACs and your heparins. But I would say just familiarise yourself with common interactions. It won't be anything out of the ordinary. It would be things that you will be familiar with leading up to pre-reg or even in day-to-day practice. Another thing to consider is monitoring requirements. So if you're dealing with a therapeutic drug, quite often they will have monitoring requirements. So just make sure that you're familiar with your therapeutic drug monitoring, and also monitoring requirements in terms of the patient's case. So for example, if they have an infection, you would be expected to maybe check, has the temperature come down, has their CRP come down, stuff like that you'd be expected to kind of pick up and question. Also have a look on the clinical appropriateness of treatment. So for example, I would say if you know that there is a patient, the patient that you've got in front of you is elderly, and they have declined renal function, and the patient's being prescribed an NSAID, it would be things like this that you'd be expected to pick up and just say, well, is this NSAID the most appropriate thing for a patient who has AKI and they're elderly? Similarly, if you're treating, for example, ACS, are the typical ACS meds prescribed as you would expect? If not, why are they not prescribed? Stuff like this that you'd be expected to kind of pick up and just question on. And those are the main things that I would say in terms of clinical screening. One thing to remember is that it's not really testing your clinical knowledge. Of course, if you pick up on clinical things, then that's great, but it is mainly testing your process. So that's why I say familiarise yourself with the drug chart, and hopefully that will kind of help you to process things a bit better. Now, in terms of the calculations test, very quickly, it's very similar to pre-reg questions. There's nothing to be too concerned about. The only thing I would say is just to check if you get a calculator or not. Some trusts expect you to use a calculator and some trusts won't. So just check beforehand. Now, going on to the second section, which is pharmaceutical interventions. I would say that more than likely you'll be given an opportunity to discuss the interventions that you have made as a pharmacist and how it has impacted your patient. So I always say that have a couple of interventions ready to talk about. Now, these can be from your evidences as a pre-reg, from CPD, or anything that you do from day-to-day practice that you feel has impacted your patient and their care. They need to show significant pharmacist intervention, and you will be asked to essentially discuss exactly what you did, your thought process behind it, if you used any resources, and if your decisions were based off evidence-based decisions, essentially. Now, in terms of the other category, you could be asked a wide range of questions. Some of them might just be prioritization, some of them might be situational judgments, and some might just be for the panel to familiarise themselves with you. So they might be more personal questions in terms of why you want to do hospital pharmacy. However, with prioritisation questions, due to the busy nature of hospital pharmacy, it's essential you recognise high priority tasks in order to maximise your productivity. This will focus on how you would categorise high priority, medium and low priority tasks. So they could give you a range of tasks. They might be from day-to-day practice, for example, on the ward. It might be in an on-call scenario. Regardless of what tasks are given to you and the scenario it is in, the same principles apply. So a high priority task will be anything that if you do not see to imminently, it may cause patient harm. So these things need to be prioritised. Everything else can kind of be prioritised in terms of how will it cause patient harm, for example. So a prime example is time critical medication, IV antibiotics, anti-epileptics, acute asthma attacks, situations like this where a pharmacist's input is essential. You'd be expected to prioritise. So it's just looking at your thought process behind that. And the last thing I would say is to situational judgment. So these might be questions in terms of assessing your professionalism in situations, such as colleague disagreements. That tends to be a very common one. The aim is to remain professional with your approach, acknowledge emotions and the different styles of people's talking and discussions. Make sure you build rapport with people, and make sure that even if you do have a disagreement, you manage it amicably and in a way that's not insulting one another. So questions like this might come up as well. Now, the last thing I'd say is just to remember that if you've got to the stage of the interview, you have the criteria they're looking for. So this is an opportunity to shine further and showcase your personality. So just take these tips on board, be yourself, and more than likely you'll be in a great position to get a job offer, hopefully. Thank you very much. Back to Usman.
Thank you, Ayat, for that fantastic insight into hospital pharmacy. I'm sure the viewers would agree. A lot of excellent information given across there, and I'm sure they'll be far better prepared for their interviews in hospital pharmacy. I'm now going to pass over to Arsalaan, who's going to talk about prison pharmacy. Now, for obvious reasons, we could not disclose his full identity, and that's something that the viewers may need to take into consideration if they're looking to pursue a career in a secured sector such as prison pharmacy. And I'm sure Arsalaan's going to touch up on that further, so I'll now pass over.
Thank you for the introduction, Usman. I'm going to talk about my experience of the interview process and about the role of a prison pharmacist and how this differs from the other sectors. So prior to the interview, I went through the role and job specification in great detail to see what skills and knowledge were required for the role and to make sure they align with the skills that I have myself. This helped me to understand exactly what the interviews were looking for in a prison pharmacist. I also rearranged the skills and qualities in the job specification into questions to later use in mock interviews. So an example of this type of question would be, tell us the time you've made a clinical intervention to benefit a patient and how did you continue to monitor the change. So going on to the prison and the organisation itself, it's important to make sure you research about the company and the prison in which you're applying, so you can see if the company's values match your own and you're more informed about the services they offer within the prison themselves and also within the community. Learning about the prison will also help you feel more comfortable in the interview itself, as you'll know more about the category of prison and what type of prisoners are in there. So moving on to the interview. For the interview, I use questions such as the example I mentioned earlier as opportunities to talk about the skills I have with examples and scenarios in which I demonstrated them. So why prison pharmacy? This was one of the first questions I prepared for, as I thought they'd ask this in the interview. So with this question, they want to know what interests you in the role and what initially piqued your interest in working in this sector. It's good to mention any prior knowledge you have of the role, and in this part of the interview, you can mention what motivated you to apply for the role itself as well. So there's a document at the bottom of the page, which is the RPS Professional Standards for Medicine Optimization in Secure Environments. This document's great to understand the role of a prison pharmacist. So my personal interest came from wanting to help rehabilitate and help with the recovery of prisoners, and I had a passion to make a difference to their lives. So one way in which I could hopefully make a difference was by removing the stigma attached to prisoners when they go back into the community, and also hoping to work with a multidisciplinary team to reduce that when they do go back into the community. So that leads us on to the multidisciplinary working. So you'll be working with other healthcare professionals. So as with most interviews, you'll be asked about your ability to work in a team, but it's important to prepare for pharmacy-specific scenarios. You'll be working with other healthcare professionals, so prepare to answer questions such as negotiating changes with other healthcare professionals and your thought process with dealing with conflicting opinions within your team. In terms of leadership and management, again, it's important to look through the job specification as it'll list the skills required for the role. It's vital you look through it and find the ones that are related to your leadership and management capabilities, and prepare examples that will showcase your expertise in this department. Questions to do with these skills can include your financial acumen and how you can help save the pharmacy department money. And another example could be, how can you motivate others in your team? So challenges of the prison sector. This is where it tends to differ from other interviews, such as community pharmacy interviews. So you'll need to think about how you deal with distressing or emotional circumstances and what experiences you've had and how you overcame them. What advice would you give other members of staff who face the same scenarios and face the same challenges as you, and where can you signpost them, and what resources are there to help. You also need to think about security issues in prison and how you deal with them as a pharmacist rather than as a prison security officer. So avoid mentioning restraining the prisoner, and think about ways to prevent further instances of illegal activities such as drug taking and things like that. So this leads us on to substance misuse. This is a common problem in society, and tackling the problem is a huge challenge, especially within prisons. So you need to think about ways in which you can have an influence in the prison to help reduce the dependence on illegal substances, and how you can assist the substance misuse teams within the prison to help rehabilitate and support the prisoners on their journey back into the community. So a holistic approach. Within the prison, it's important to incorporate this into your work and your way of thinking. A large number of patients may suffer from conditions such as anxiety and depression. So treating the symptoms of these conditions is essential, but also looking beyond that towards their physical and social well-being is crucial to the health. For example, how can you identify their needs beyond their medications? Who can you refer them to within the multidisciplinary team or within the prison if it's out of the scope of your competency? And how can you ensure there are processes in place for continuity of care after they leave the prison? These are all questions I thought of before my interview based on the job specification, and they ensured I was well prepared for and confident for the interview. Again, I'll just mention that document at the bottom, the RPS professional standards for medicines optimizations in secure environments. It's a very good document if you want more insight into the role of a prison pharmacist. I read it before my interview, and I would say it's a vital read if you do want to work in the prison sector. So thank you for listening to me. I hope this gave you an insight into life as a prison pharmacist, and hopefully any of you looking at a career as a prison pharmacist. So I'll just pass you back to Usman now.
Thank you for that, Arsalaan. Some great detail into prison pharmacy. I'm now going to pass you over to Aiysha, who's going to talk about primary care.
Thank you, Usman. Well, that was fantastic, Arsalaan, and I really hope our viewers enjoyed that as much as I did. You gave a really insightful look into a prison pharmacist role, and I must say, I love the new look you've got. You will have to share the name of where you got your haircut. I think I'll have to head there next. So, carrying on, as Usman said, I'll be going over primary care. So what we're going to do is, I'm going to go over PCN specifically, as this is what you've all requested the most. Although most is transferable across the different primary care sectors, so don't be alarmed by that. What I'd say to start with for interview preparation is, you've applied, you've got an interview. Now ask yourself why. Why have you applied to the CCG, the GP, PCN? Why have you gone for this practice role? When you go to an interview, they will always want to know what made you apply. Even if it's not direct, they will be asked. Now, you need to ensure you've got the correct understanding of the role and its purpose. I know this sounds quite self-explanatory, but it is also okay to ask yourself that question. I found myself in a situation where actually, when I'm asked this, it's hard to initially put your reason or your passion into words. So it's always good to just think about that before you go for an interview and keep it at the back of your mind in case it is questioned. Also, going back to what Arsalaan said, it's not just about the interview and how you present yourself. It's really important that your values align with the institution, to be it a practice, be it a specific PCN or another area of primary care. It's an environment you're going to be in for more than 8 hours a day at times. So make sure you know why you want to be there. With primary care, as again, this is any sector, just when you're applying, be it the passion, the change of dynamic, the clinical pharmacist role is changing. And if that's the reason you want to be there, or it's because you want to see more clinical interactions and face-to-face care, just know about it before you go. So the interview, as Sarwar said in his slides, ensure you ask beforehand what the format is. Generally for PCNs and primary care, there's always a set time for how the interview process is. So you tend to have a case before you then head into a panel where you'll go over your findings and suggestions. After which there's a general interview process. Now this can cover different areas. So it'll be clinical, SJTs, general questions, and a little bit about you. Now, before I carry on, a common question PharmaSense and I have received is, what is a PCN? So Sarwar has explained in part 1 what the PCN stands for, Primary Care Network. But what does this actually mean is what we keep being sent in. So PCNs are a network of practices who have come together under this umbrella. And although they are independent practices, they actually work together to achieve the NHS long-term plan goals. A PCN typically covers about 30 to 50,000 patients. It could be more at times. It depends on the size of the practices that are formed together. Most of these practices will be close by to one another, so don't be alarmed if you're working for a PCN with 5 or 6 practices. They do tend to be quite close by. You may be able to even walk to them. So now that we've all understood what a PCN is and generally what the interview might feel like on the layout, let's start with the actual interview. So, case-based assessments. I have not come across one interview format in primary care, actually even in other sectors, that doesn't involve some form of clinical case. The primary care clinical case is not a drug chart. It's not a prescription review. It is a full clinical case, something you may have seen in university. Please don't let this put you off. We've had many people who have been daunted by this, and I think it's really important to remember we've all got an MBOM. Some of us are pre-registered, some of us are provisional registrants, or some are qualified pharmacists. You have the fundamental foundation and understanding, so you can do this. You will pick up the skills that are needed throughout your time, and even when you're looking through, you'll actually realize a lot of this stuff is what you do every day. There's also lots of case example studies online where you can go over and practice with. And to again reiterate what everybody else has been really saying is contact the point of contact via email, call. If you genuinely have never seen a case-based review or a case, contact them, tell them that, and let's see, they could be helpful and give you sort of an insight. So generally with case-based assessments, if you can practice beforehand, familiarise yourself with patient notes. It's very important to understand how to provide a holistic approach in treatment and tackling the issues highlighted in that way. So you'd usually have a past medical history. What I found is very useful here is link the conditions with the medication. So you'll be able to write on your sheet and they'll give you a pen or pencil and put arrows next to things. So if there's inhalers and it says COPD or asthma, like link it across. If there's medications that are listed, it seems like an acute, but it doesn't match with the condition. Say if there is nitrofuran towing, but there's no UTI indication, write a question mark next to that, query it. Nothing is ever perfect, especially in interviews to try and see if you'll pick up on these things. So if things don't add up, don't be afraid to ask why. This is what this exercise is trying to see. If you're going to communicate and use your clinical judgment and query things, please remember, regardless of sectors or professions, or even if it's something you're doing outside of pharmacy, there is no such thing as a silly question. Life is full of questions and we have to ask them. And ultimately, as a clinical pharmacist, your questions will help a patient and we will prevent poor management. And that is what the general aim here is. With medication, please go back to Ayat's section. She really covers some very key interactions that you'll come across in any sector and that you will come across in the primary care interviews. I'd also say, to add on to that, look for common issues. Now, is this patient regular paracetamol? If you look a little bit further down the case base that they've given you, does it say PRO and cocodamol? Is there a PPI cover if they're on an NSAID? These are things that are so easily overlooked, but they're such key flags in long-term management. And you will come across these every single day in primary care, if I'm quite honest. Next, you'll get a bit of a section about differential diagnosis and diagnosis. So this might cover, and you might want to be thinking about medications may need to be used here to treat the patient's possible conditions, sort of get you ahead of the situation. You could also talk about linking in with other areas. So if that's, say, a social prescriber, and I'll talk about this a little bit later, but linking with the other members of the team. Now, social mobility, this might not seem like, what has this got to do with pharmacy? What's this got to do with me being a pharmacist? The reason this is important is look at the sheet, because in real practice, you're going to be looking at the patient who uses a walking frame. Do they have carers? What's their diet like? Now, if this patient has small meals, if they're elderly or if they're a child, and they only have one big meal at breakfast, review their medication, look back up. If they're on metformin 500 milligrams once a day, it's better for them to have that in the morning with that meal. So this is why it's also important, again, holistic view. If you can, look over the local formularies. A lot of places up and down the country, you can actually access this from Google. You don't need accounts. Most places have the same primary and secondary use of medication. It's just guidance slightly might change in regards to what can be prescribed in which area. Biochemistry, this may feel like the pre-reg exam revision and it may feel like university again, but know your basic parameters. So sodium 135 to 145. Think about creatinine clearance. Is it in range? Are they on a DOAC? Is it still suitable? Because remember, if you're on a DOAC, if you're on a Pixaban, for example, if your creatinine clearance is less than 15 mils per minute, you should not be carrying that patient's DOAC on. Know your HbA1c ranges. See if there's any guidance. For example, in needs, there's a specific guidance for elderly populations. And if you're classed as moderate, severe, frail, your HbA1c can go all the way up to 58 millimoles per mole and only stay on metformin, they still might not titrate you up. Again, going back to what the others said, and especially what Ayat covered, know your basic targets for your BP, weight, creatinine clearance. Just know what they are. Even if you don't understand, it's really important to just say and be honest. Highlight that you'd look at these. I'm not too sure where to look, but if I was in practice, I would use online resources. Just highlight that you know that these things need to be looked at. Another thing that's really important, and I physically have seen this in practice today, your blood pressure. So if you see high blood pressure, they're on medication, things aren't adding up, they might have some impaired renal function. Query and have a look down on what OTC medications they're on, because in real life, this is the point where you're querying OTC medication and you'll find out this patient might have been on ibuprofen OTC daily for 3 months. And suddenly you realise why they've got increased BP, poor renal function, even though they're on multiple hypertensive medications. Now, what you'll see on your screens is something about care homes. Now, something I want to put out here is because we keep getting a lot of questions to do with care homes and elderly people. Care homes are not just elderly, it can be any age, and there are different types of homes. These could be for elderly, young, disabilities, palliative, or respite homes. These are for short-term stay. So if you have patients coming out of hospital and they just need to be somewhere for the rehabilitators to come home. So for PCNs, again, primary care, understand the health of the ageing population and what factors to consider. So when we're going back to elderly population, this is important. So think about their medication, what could be causing falls. Consider anticholinergic burdens. What are the anticoagulation factors? At that point, look for INRs, bone protection. It's really important, like Arsalaan said, holistic approach is so important. Be it a social need, a memory, do they have carers? Is there a MAR chart? And then again, thinking overall, stuff you will be commonly seeing is PPIs, and part of the primary care GP practice, you will be seeing a lot of elderly people who will get osteoporosis if they're on PPI. So just have these links and think ahead. And again, opioids, will these cause confusion? Will these cause falls? There's obviously a whole another factor to that of addiction, so keep that in mind. So we've got through that bit. What's next? You'll probably have to go back into the room and they'll go over your case with you and just have a nice, it tends to be a casual, most of the time, conversation to understand your thought process. Then you go into the whole panel interview. What I'd say here, and again, I'd apply this to everywhere, is who is on your panel and what are their areas of expertise? So is there a cardiac specialist? Refresh on your DOACs and your hypertension. Understand who they are, because it shows you really want this job. Look at the panel. Is there a clinical director? So clinical directors, they lead the PCNs. Now, please look into this, because we've had a lot of people saying that there's always Dr. CDs, and we've actually had to tell people who've been contacting PharmaSense that actually no, clinical directors can be GPs, pharmacists, nurses, and you need to be aware of the wide opportunity you have in primary care, really. You could be a clinical director in a few years to 10 years time, who knows? If there's a GP partner on there, look at the GP contract, understand what targets they might need to be hitting and bring that in there, because you're also working for their practices as a PCN, but think about how you can sort of bring that across, that you're there to be a clinical pharmacist all around. Now we get to you. This will be on the panel as well. So think about responsibility, your ability to think outside of the box, and accountability, be this any area of pharmacy, community, hospital, prison, primary care, you are always accountable. So you need to be able to act with significant discretion and make sure what you do makes logical sense, and you'll be able to go forward and present that always, knowing that you have looked at all the clear clinical guidance. And again, just put that across in an interview process. Pre-reggers, please utilise your evidences and bring these examples to your interview, be it printouts or in your mind. These will really help you here. Don't think that just because you're a pre-reg, you can't bring anything. You are not just a pre-reg, you have just completed 4 years of university. So generally, you may be asked here what your everyday life as a pharmacist is like. Everything you've done is transferable in primary care. This is nothing new. Your CPD is reviewing the script. These are all transferable. What I'll also highlight here, if you're a community pharmacist, because we've had a lot of these questions, simple things like bringing in a generic, why is a generic not being prescribed? Why are we having branded medication? You are optimizing prescribing, and you will make the GP practice very happy because you're saving them money. And of course, that's important as well. They are a business. If you've had a difficult patient, think about it, bring it forward, give that as an example. And please, please, please talk about how you fit into a cohesive team and how you'd adapt. We know the team keeps talking about multidisciplinary team, but that is the future of the NHS. That is the current NHS. And as pharmacists, regardless of sector, we need to be able to think with that mindset. In primary care, you're also going to be working with nurses, doctors, physios, more than you may even see in other pharmacists, to put across how you will liaise with those members. Even if it's, I'd put into context, I have WhatsApp groups with my friends. I have used that in interviews before and say that I'll make a WhatsApp group with my PCN and make sure we communicate. And actually, I've gone ahead and done that, and it's worked fantastically. And this is also your area to bring to the table what you've got, what your thoughts are, and how you'd look at things from a different perspective. So I hope I'm not overwhelming anybody. We will get to the next bit. I'm just going to add in situational judgment tests, as you had in your oral interviews. And those who didn't sit these, there are examples online, but please go back to Ayat's question and the areas that she's covered, because she's actually covered these in quite great detail, and actually they are exactly applicable to primary care. Also communication skills. Now, these have been covered by everybody else, but what I will add in is, it's important how you communicate with the MDT and how you will communicate changes, because if you aren't a prescriber, which will be quite a lot of you, how will you discuss those prescribing issues? And if you are a prescriber, what's your area of comfortable competence? Be vocal in any agreements beforehand and queries at your interview when you're going over cases. How would I put this across to you in real life? How would you like me to discuss this with you? Would it be post-clinic? I have briefly mentioned about local formulary and guidance earlier on, so please just have a look over and familiarise yourself with the basics if you can. If you can't, that's fine. Just mention that you have seen it and you are aware of where to find these. Local population. This is very important. If you don't listen to anything else, please listen to this. So when you're thinking about PCN interviews, it's all about this cluster of umbrella of practices. So their local population is what everything they will be doing is targeted to. Think about health inequalities. Have a read of the Sir Michael Marmot review that recently came out, and it really highlighted the differences in the north and south and divide in health inequalities. Think about the demographics and the sizes. Are there lots of care homes? Are a lot of people in this area underrepresented? Is there high blood pressure? Can you advertise increased exercise? Can you work with your community pharmacist here? How would you put this across? And discuss quality improvement projects. Bring in the research you've done at university, at pre-reg, during foundation training, or just generally. What I'd also just say is understand the directed enhanced service. This is the DES. It underpins the roles of the PCN, and it provides direction of what needs doing and how you actually are delivering the service specification. Your entire job role as a PCN pharmacist is based on this. So have a look over. It does briefly say that your role will be undertaking structured medication reviews, also known as SMRs. We've had people ask us this. So yes, that is what that means. You're looking at complex polypharmacy, which is 10 or more medication, frailty, and working with the community pharmacies on the new medicine service. Systems have been briefly mentioned. So we use System 1 and EMIS, and these are ways to record patient data and add read codes. These are specific codes that will identify if multiple patients have got hypertension, if multiple patients need their shingles vaccine. Now, this is my favourite question, because I think we've all lost count of how many of you ask questions about this. Educational development pathway. So as part of the contract, to be a PCN pharmacist, you will be put onto the CPPE primary care pharmacy education pathway. This is 18 months. It's funded. Please do not worry about how you're going to save money for this. We've had a lot of concerned people coming through to the team. This is covered for you. It covers a lot of leadership, clinical skills. There's a quality improvement project in there. Yes, you will be able to be prescribing as part of this, but we just need to clarify, because again, we've been getting a lot of questions. You do need to be 2 years qualified before you can do the prescribing module. Now, if this changes in the future, keep an eye out on it, and we will notify you all from our networking groups or from our social media if this changes. But as of right now, you do need to be 2 years qualified, and then you will be able to do the prescribing. And again, it's included within. So I hope I've given you lots of information about interview preparation. I'll just add in something to do with resources. So these are some great resources to look over prior to your interview. So the RPS have got a fantastic page talking all about GP practice and primary care. So wherever you want to go, there's guides and useful links and resources. Primary Care Pharmacy Association are fantastic. They basically are representing all of us in primary care. They're constantly updating stuff for pharmacists, technicians. They're very much on the ball. They have Telegram groups. They have regional representatives who are very supportive as well. Obviously, you have the NHS long-term plan. This will give you an idea for primary care, but also other sectors. Quiz and Quaff. We've had lots of different explanations what people think these mean, so I will put people out of their misery. QOF is the Quality Outcome Framework. So this is indicated as part of the GP contract negotiations. Now, they're updated every year, so these include things such as managing chronic conditions, so asthma and diabetes, smoking and obesity. Pharmacists, you will be involved in this. We know everything to do with inhalers, so asthma reviews, working with the nurses, patients over-ordering salbutamol, liaise with your nurses. Quiz, so this is the Quality Improvement Scheme. This is an incentivized scheme. It's basically looking to improve outcomes, reducing unwarranted variations, and helping the practice work together on like very large projects. Again, pharmacists, you will find yourselves leading these discussions between your practices. So yes, a lot of independence leadership, so put that across in your interview. Then just have a look at the BMA, Primary Care Network Handbook, and of course, as I discussed before, the DES, you can find it if you put that into the Google search bar. I hope that was very helpful. I will now pass it back to Usman.
Thank you, Aiysha. That was fantastic. I'm sure everyone will agree that it was an amazing insight into interview preparation for primary care. I'm now going to pass over to Nabeel, who's going to talk about the community sector.
Right, guys, so I'm just going to talk you through community pharmacy and interview preparation for community pharmacy. So interviews for community pharmacy posts are similar to those in other sectors as discussed by the other panelists, in the same manner that you would be required to demonstrate specific skills, patient-centered care, and discussing your approach to scenario-based questions. So before I go into interview preparation for community pharmacy, it's important that you understand the job posts in community pharmacy can vary from pharmacist roles with or without managerial roles, pharmacy manager roles, or relief pharmacist roles, as Sarwar touched on when reviewing job adverts, all of which may cover similar interview style but will require you to demonstrate specific skills and attributes for those positions. I'm going to discuss some of the key skills and attributes that would apply to all of these varying job roles. Most interviews will have some form of scenario-based questions and skill-based questions. These questions are to understand the thought process and how you'd arrive at the answer in a similar manner discussed by Ayat with hospital interviews. So I'll talk you through some of the differences between the two. So with scenario and skill-based questions, scenario-based questions are designed to put you in the midst of a problem that's arisen just to see how you'd react and respond to it and how you'd arrive at your final decision or outcome. It's important that you share your thought process on how you'd approach the situation and any key information you'd require to make a more informed approach if you were lacking information. And it's worth talking about how you'd gain this extra information. So for example, if it was a scenario that involved a patient, you could discuss what information you'd require from the patient and what questions you'd need to ask the patient in order to gain this further information. Utilize your resources and knowing what information or guidance is out there that you can consult to further to strengthen your decision as well. This shows that you've really thought about the resources that are available to obviously make a more informed decision. An example would be to refer to the MEP for potentially ethical or legislative guidance. Another example is ethical consideration in the context of emergency hormonal contraception for underage females, and that you'd look to consult with the Fraser guidelines, for example. So if you're unsure and you've formulated multiple responses to the scenario that you are given, it is useful and it is worth mentioning all these potential solutions and the specific outcomes for each solution that you've mentioned, and weigh them up for selecting the most appropriate one. This shows that you've got a high level of thinking and shows that you've actually considered multiple approaches, their outcomes and potential implications involved with them as well. And you've not just jumped and decided on the first one that's come to mind. So on the other hand, skill-based questions might be more direct, where an interviewer may ask you to give a specific example on when you've demonstrated a specific skill, such as teamwork, leadership, or even delegation of tasks. And it's a common example that's always used in community pharmacy as a question at interviews is how you'd manage a team, because you're always working within the team, and as a pharmacist you're always leading a team as well. So it's always worth following up your answer with an example where you've conducted the skill that's been asked about. What I would suggest is to make a list of all of the skill sets that are required for the job role, which you could do for any job role in any sector that you're applying to. It doesn't have to be just community pharmacy, and you can find this list of skill sets in the person specification. So this is what they're looking for as a person, as the ideal candidate. as I was mentioned previously. And then what I'd suggest is you list examples in practice or in training when you've had to demonstrate these specific skills that they're looking for. So for the pre-registration pharmacists that are listening in, you could utilize the evidences that you've been writing as examples when answering these specific questions as well. Next, I'll move on to dealing with conflicts and disputes. This is a massive area, and if you've been working throughout the COVID pandemic, you probably realize conflicts and disputes tend to arise really quickly, especially due to increased working pressures and stress as well within the team. There's obviously angry patients that are not getting the medication on time, or even with GP practices as well. Obviously, it is important to maintain that level of professionalism, but what would you do when conflicts do arise or disputes do happen, which is common regardless of what team you work in? There's always differences in opinion. So with patients and colleagues, you can talk about conflict resolution. So these are specific examples. So even dealing with abuse from customers, and talk about how you as a person have mediated within these conflicts, how you've gone about conflict resolution, how you've de-escalated a situation from getting worse and then coming to some form of resolution. Demonstrating patient-centered approach. So patient-centered approach is understanding the context of each patient and understand that it's not just limited to their medication. It's often difficult to do this in working practice due to the nature and of interactions and the workload, especially in community pharmacy. But try to incorporate this in your consultations and your counselling whenever you do get the chance to speak to patients face to face. Again, this might be similar to skill-based questions where you're asked to give an example of a time when you've demonstrated this. The interviewer wants you to understand that the patient is a person, and there's many other factors that can be overlooked, such as behavioural and social factors that can improve or deteriorate the patient's health. So it's important to view the patient holistically in order to address patient concerns and provide advice based on this. Examples of behavioural factors can be whether patients have got alcohol problems, they're drinking excess amounts, whether they're smoking, they're obese, etc. So it's worth looking into this as well, using specific examples. Patient-centered approach allows you to view the patient holistically and understand the concerns like I've mentioned. And obviously medication isn't always the answer to every OTC consultation that you have with patients. Often patients present with medication-related issues such as side effects from their prescribed medications or any medication that they've been already taking. So it's important to understand when it's appropriate to offer pharmacological treatments or whether lifestyle advice might be more appropriate, and identify ways to optimize patient therapy as well. So examples of when you can do this in practice is by doing the medication use review or even the new medication service as well, where you're able to identify potential issues and then flag these up to the GP on behalf of the patient, obviously with consent. Patient-centered care. So again, examples of how you've gone out your way for a patient. This falls within patient-centered care as well. So this is something that links in with the attributes of empathy and compassion. As healthcare professionals, there's always an element of empathy and compassion in conducting our day-to-day roles. And it is one of the main reasons why a lot of people sign on to studying to become healthcare professionals. So it is important to demonstrate this throughout the use of examples. And I'm sure many pharmacy professionals and students have gone out their way by putting patients and their needs first during the COVID-19 pandemic. An example would be delivering medication to shielding patients. No matter how small an act may seem to yourself, you are ensuring that the patients aren't going without the medication. So even a small act such as that is worth mentioning as well. Moving on to meeting targets, we've mentioned this as well. Bear in mind, community pharmacy is a business model as well. So there are key performance indicators that they'd be looking for you to meet, and they'd like to see your sort of approach to this as well. So there's specific ways of meeting targets that are outlined by specific organisations, but if you're ever asked this at an interview, they want to see whether you can think outside the box and think in ways where other people haven't. This again will help you stand out because it shows that you've got something to bring to the company that you're applying for as well. So obviously targets involve EPS nominations, MUR and NMS targets as well, and other services, whatever services the organisation or the community pharmacy offer. An example would be in the primary care sector. Based on my experience from what I've seen, GP surgeries have introduced a birthday review where a patient would have a medication review in their birth month as well, and this is a way to synchronize their reviews, so they're having an annual review and it's at the same time every year, so it's easy for patients to remember about them, that they're actually due a review as well. I'm just going to move on to strengths and weaknesses. So this is something that can be mentioned in interviews as well, and often people get thrown off when they get asked about weaknesses opposed to strengths. Everyone can easily talk about what their strengths are. Strengths are apparent to us. Weaknesses are often difficult to talk about. So weaknesses, the only way you really know about weaknesses is if someone's told you that there's a specific skill set that you need to work on and you need to improve, so you've been given some form of constructive feedback. Or weaknesses arise when you've reflected on your practice, so you've understood that you're deficient in a specific area, you've reflected on that, and you've formulated an action plan to work towards overcoming that weakness and to working towards turning a weakness into a strength. So if you're ever asked about weaknesses, always reply from a reflective point of view as well, and how you'd overcome specific weaknesses as well. Another question that's quite common that's asked in community pharmacy is, where would you see yourself in the future? This one is an important question because it demonstrates your motivation as a person and development and drive as well. So it's important to share your aspirations and outlooks as well. It shows that you're motivated and determined to succeed. And again, depending on how you respond to these questions as well, it will set you apart from other candidates. Another question I'll just throw in there as well is, why community pharmacy? Again, this can throw you off if you've not really thought about it. Obviously, community pharmacy, there's a specific reason why a lot of people prefer this over other sectors, and continuity of care is one of the main reasons where pharmacists are able to see a patient continuously on a monthly basis as well. So they're able to continuously catch up with that patient, whether they've been in and out of hospital. And often community pharmacy is the first point of call for most patients as well, because we are the most accessible healthcare professionals within the community as well. So again, there's long-term rapport and also patient-facing as well. A lot of pharmacists do enjoy the leadership aspect and management roles within that. And again, like I've mentioned, it is a business model as well, and a lot of pharmacists do enjoy the business side of things and meeting targets. Legalities and SOPs. So if you've never worked in community pharmacy, or if you've worked in a different sector and you're looking to apply to job roles in community pharmacy, it's worth looking over the legalities involved in community pharmacy. So the main thing I'd probably point out is the responsible pharmacist roles and what you can do when a responsible pharmacist is signed in, when they're absent, and what this means for the team as well. So I'd suggest to familiarise yourself with this. There's a section in the MEP as well that relates back to the responsible pharmacist role, what tasks and activities can be undertaken when a responsible pharmacist is signed in and when they're not. So SOP stands for Standard Operating Procedures. Each company will differ in their SOPs, but it's important that you read, understand and familiarise yourself with them. Obviously, that's when you do come to working for an organisation, and do bear in mind each organisation will differ in the way they practice as well and how they conduct their day-to-day activities. It's important that you show that there is an importance towards abiding by SOPs. Again, this is something that the organisation themselves have sort of set in stone, that this is their procedures and this is what they'd like you to follow as well. So read, understand them and act in accordance with them as well. There's a document that we've added to this slide as well. It's the PSNC Community Pharmacy Contractual Framework. I'd suggest reading over this and understanding how community pharmacy is involved in delivering the NHS long-term plan. So a couple of sections are worth looking into, especially if you've not worked in community pharmacy before. Within this framework, it highlights different levels of services that a community pharmacy may be involved in. I'll just quickly touch up on them as well. So essential services such as dispensing medication and appliances, clinical governance, discharge medication services and public health, so health and lifestyle promotion, etc. These are essential services that all community pharmacies have to deliver. Advanced services in community pharmacy, such as the more recently outrolled community pharmacy consultation service, also known as CPCS, medication use reviews, new medication service, appliance use reviews, and even the flu vaccination service. So it's worth understanding that not all community pharmacies have to offer these services, but a lot of them will be. So it's worth understanding these services and what they mean and what additional training that you may need to do to undertake these services as well. And then the last thing I'll point on is locally commissioned services such as minor ailment schemes and other services that have been commissioned based on the demographics of the specific area for that community pharmacy. So it's important to look into what services are being offered by the community pharmacy that you're applying to in the specific area that you're applying in as well, because each area and each demographic will differ, and obviously these services are based on the population as well. So yeah, I hope that's been useful. I'll now pass you back over to Usman.
Thank you, Nabeel, for that insight into community pharmacy. Now we've covered community pharmacy, the prison sector, primary care and hospital pharmacy. Now I'm going to ask Sarwar to talk about some general interview preparation tips.
Thank you, Usman. A lot of you are at the interview stage already, and congratulations on getting here. First and foremost, if you've reached this stage, the place of employment has been impressed by your application, and the interview is the next stage of the securing the role you have worked so hard for. With the COVID pandemic, interview formats may be different. Some may take place virtually through platforms such as Microsoft Teams, Zoom calls, or they may be face-to-face with the addition of having to wear face masks. I will generally speak about things that should be prepared for all interviews. First and foremost, through all sectors, learn how to answer the following. Tell me about yourself. This is a commonly asked question across all professions and not just within pharmacy. Although it is known as one of the most common questions, it is one that causes many to stumble within interviews. See this question as a perfect opportunity to introduce yourself in a professional and exquisite manner. Show your passion about your current role and show that your other interests and skills outside of pharmacy too. This question is essential to have prepared and tailored for the role you are applying for and should be practiced prior to the interview. A good way to answer this question is to discuss the present, past and future. So briefly describe your current situation, what has led you to it, and your thoughts and plans for the future. Try instilling passion within your answer to demonstrate to the employer that you are an enthusiastic, forward-thinking individual. Furthermore, throughout the interview, have in mind things about yourself, not only in pharmacy, but outside of it too. These can include other courses you have done, extracurricular activities, hobbies, and other interests. Examples can include charity work, leadership courses, being part of a regular commitment, or playing for a regular sports team. Although you may think this is not relevant, it is important to discuss extracurricular activities, as this demonstrates to the employer you have social skills, you have other interests, and to also for the employer to be able to gauge an understanding of yourself and see your communication skills. Utilize these extracurricular activities and the interests to not only list what you do, but to also show the skills and qualities you have gained from them. Within the interview, it is important to understand the educational framework for the role, what is required, and discuss what attracts you to the role in terms of a training perspective. Candidates should know if the role is for a diploma position or not, what training the role encompasses, and what the employer has mentioned will be required for the candidate to enroll onto as part of the role. It is imperative to have this information prepared, as this will demonstrate to the employer you have thoroughly read into the role and understand all of what the role encompasses. As mentioned previously, a trust, a primary care network, or a company's mission statement/values is essential to have knowledge of throughout all stages of the application process, and even more so for the interview. It is important to have examples ready how you have demonstrated these values in your own work in practice, or it can be through extracurricular activities. These values are always asked, and a failure to read into this area or failure to practice these questions will lead you to lose out on a perfect opportunity to demonstrate your passion and enthusiasm for the role. Whichever sector you are moving into, understand the pharmacist role is evolving. It will not be the same in 5 to 10 years as it is now. The role is moving towards a more patient-centered clinical role. So have an understanding in the direction each sector is going in, i.e. what new services are coming out, what the role is becoming. Showing that you have a forward-thinking mindset will only show you as an asset in the employer's eyes. Questions that are commonly asked that go through all sectors include the give me an example when you demonstrated type questions. So have examples of leadership examples, teamwork skills, communication skills, times where you resolve conflicts. Once again, have examples of these both ready from working practice and activities outside of pharmacy as well. So at the end of every interview, there will always be that question asked to you. Have you got any questions? Do not say you do not have any questions. The reason for this is that asking appropriate, well-thought questions gives you a chance to learn more, show your passion, and give a memorable final impression. So have questions ready for the employer. These questions should not be questions that you should already know the answer to. Tailor these questions in a way where you are asking what you can do for the employer in the given role, not what they can do for you. Choose questions that demonstrate that you were engaged and listening, and ones that can help you learn more about the role. Things that weren't covered in the interview are good to ask about. You can also personalize these questions to whoever is conducting the interview. Ask what they enjoy about the role. Ask what direction they think the organization is moving forward towards. We all have heard that saying, practice makes perfect. Practice and role play with your colleagues is essential in the PharmaSense team's beliefs. Although you cannot predict what exact questions will come up in interviews, a lot of times many similar questions come up. It is important to have these mock interviews. This will put you more at ease, identify weaknesses in your interview, or skills or questions that you are not so good at, okay? And this will all put you at the best position possible prior to that of the all-important interview day. By failing to prepare, you are preparing to fail. So it's essential to prepare, and part of that preparation is having read into key essential resources and reports. As you can see from the slide presented in front of you, these are things that will come across all sectors. So Lord Carter's review, the Francis Inquiry report, PSNC's controlled drug and serious incident reporting, NHS improvements never events, the duty of candour, read into the yellow card scheme, and also a fairly new document that's essential to read is also First Do No Harm as well. So in summary for this section, be confident, demonstrate your passion and demonstrate your worth. Thank you, and I'll pass over to Usman again.
Thank you. That concludes the second part of the webinar. We hope that all the viewers have gained a better understanding on the application and interview process across the various sectors in pharmacy. Finally, I'm going to ask the PharmaSense team for their closing statements and any final tips they may have, starting off with Sarwar.
Thank you. So I hope everyone listening has benefited from the video. You have made us all proud and have shown the public and the profession how strong and resilient healthcare professionals you all are. So be confident, be passionate, demonstrate your skills and show your knowledge. Know myself and the rest of the PharmaSense team are rooting for you all. And one last message, good luck.
So I'd just like to emphasize on what Sarwar said. You guys have been brilliant, especially the pre-registration pharmacists who are now becoming provisionally registered pharmacists, especially with all the uncertainty. The one thing I'd like to emphasize on is when you are applying for jobs, be sure to read the job specification, the person specification, and actually tailor it to yourself and to the job itself as well. And highlight these aspects within your application. It'll help you come across as a stronger candidate that's really taken into account all the requirements of the job that the organisation has put in place as well, and it shows that you've actually read into it as well.
So my top tip would definitely be, do not write yourself off. Be that because you feel you're going into a different sector or by how many years you've been qualified. Ignore them all, just go for it and be confident and be passionate. It will definitely come through.
I'd also like to echo Aiysha's statement there. Be yourself and go for it. What I would like to add as well is just to make sure you do plenty of research before you go for any interview that you do, regardless of what sector is in. The panel and I have suggested a wide variety of resources and frameworks that you can look at as well. So make sure you just do your research, plan and prepare, and you will all be great.
Thank you to all the speakers today. You've all done a fantastic job. We have tried to incorporate all the questions sent in by our social media platforms. However, if you have any further questions, please don't hesitate to contact the PharmaSense team. We hope that we have helped potential job candidates to succeed in securing their dream pharmacy positions. Don't forget to share, like, and subscribe.